Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about soliciting honest feedback from patients. Do you know how patients honestly feel about your practice? Do you have any idea the impression that your staff makes on patients? What's your reputation in the community? These are all important questions, and with technology and people being more diligent at reviewing a lot of businesses before they become patrons is really important, especially in healthcare. With the cost of healthcare being so high for most people, they're wanting to make sure that they're not going to waste their time when they go see a medical professional. They are going to do a lot of research, whether it's asking loved ones and friends if they've seen someone in a certain specialty. They're going to be asking on community forums. They're going to be looking at Yelp and Google reviews. This is the day and age that we live in. And if you don't have a positive review or impression on your patients, they're not going to be referring to you. They're not going to be coming back, and that can affect your bottom line. So today we're going to talk about why patient feedback is essential, right? What can it do or not do in your business that you might need it to do or you don't want it to be doing? The patient feedback is essential because it drives quality improvement, right? I mean, if you know that someone isn't happy with something or something happened, you're going to be trying to improve it overall, hopefully. It helps you retain patients. Obviously, if they're happy and comfortable, they're going to come back. It supports your online reputation. Again, the world we live in, people use that technology. It's very important. And it impacts payer relationships in value-based care. Remember that value-based care is based on patient outcomes. You are not getting paid on fee-for-service on just whatever you're offering to patients and billing. It's very different. So today I'm going to cover 7 simple ways for you to be able to gather patient feedback. And again, with this feedback, you need to be doing something with it. So it's great if you're going to take my advice and gather the patient feedback, but you have to have a game plan of what you're going to do with it. But anyway, okay, so let's just jump in. You want to look professional and caring in your community because let's be honest, the number one most powerful form of advertisement is word of mouth. Even with the internet and technology, people are still going to be more prone to go see someone or use a business that someone they know and they trust gives a high mark to than just reading it or cold calling somewhere. This is really important because word of mouth is number one, and you need to treat people like you would want to be treated. Number one golden rule, right? But so do your staff, so does the impression that you're building, the inside of your office gives, okay? So the number one best way are email or text surveys. The minute a patient has an appointment, or even you could go as far as if they have a phone call to your office, it depends on how, extensive you want to be. You submit an email or text survey to them. Hopefully you have that contact data on file, and you're asking them to provide feedback from today's visit or interaction with your staff. The nice thing about that, it's automated and you can keep it really short and it's mobile friendly. People like being able to do things on their phone. That's why apps are so popular, and that's why so many people who used to have an online platform only now have an app to make it easier for people because they take this with them everywhere. It's a little mini computer. I know I don't have mine in my hand right now because it's filming us, but pretend I do. Phones, the easy application is really important, okay? Another idea is that you could have kiosks apps or tablets in your waiting rooms. And while people are waiting, you could even put them in the exam rooms, I guess, if you wanted to. But while people are waiting, you could ask them to review your office staff, the environment, the providers, anything that they've been exposed to. It's a good way to kill time. And if it's touch screen, it's just boom, boom, boom. And most people are used to that now. Utilize your patient portals. This is the third one. Patient portals are super helpful in many ways in the practice, including getting patient feedback. It is one of those things that they could be checking their emails, they could be logging in to check lab results, something like that. While they're already in there, maybe something can pop up and say, can you take a quick survey? And it done. They get taken care of and it's out of mind and they did it for you, okay? Comment cards. Some people do not like electronic means of communication. Usually that's our older generation, but not always. Sometimes there are younger generations that prefer the old school pen and paper, which I totally respect and understand. So having comment cards available in your practice, maybe in the exam rooms or in the waiting room, where people can write down their comments and put it in a box that's locked, kind of like those old school ones we used to have at work that we could put our comment cards in, suggestion box, whatever you want to call it, and encourage patients to do it. One of the things about these feedback is you want to make sure that you're communicating to your patients that they will be receiving something or that you appreciate their feedback and why you would like their feedback. Because I think if they know the why behind it or you have that personal interaction discussing it, they're more likely to complete it, including the paper comment cards. Phone follow-ups. If you had someone who had just a really poor experience or they're a high-risk patient, while you're calling them maybe to do a follow-up on how they're doing, maybe also take advantage of that and ask how their experience was at the same time. Kill two birds with one stone. Now, phone follow-ups probably aren't going to be as popular for the initial feedback, but if you get a really poor feedback or you get like a stellar feedback that you just want to let the patient know that you saw it and you're responding to it, whether it's good or bad, I don't think that's a bad idea. Getting on the phone, speaking to someone person to person can go a really long way, especially in those really bad situations. One of the things you'll notice that I like to use, and they're growing in popularity like crazy, are QR codes on handouts. So if you have a handout for your practice or you have something hanging on the wall that brings attention about something, or it's an announcement, a bulletin board, having those QR codes even on your website that they can scan to take a survey, very helpful. A lot of people are catching on to those. And again, I'm a fan of them, but just think about maybe generating a QR code and asking patients to take some feedback surveys that way. And lastly, an online review request. You can ask happy patients to leave reviews on Google, Healthgrades, ZocDoc if you're using that. There are different ways. Yelp is another one, I think, probably not as popular for healthcare, but it still is an option. Because unfortunately, in our day and age, it seems like the impression is that more unsatisfied or dissatisfied people will go leave bad reviews on internet, online reviews than good, happy, good, positive reviews. And so it is important that you are asking people who have had a positive experience to also go on and give you those positive online reviews, especially on those specific healthcare platforms. I would definitely make sure that someone is monitoring all of this. Again, if there's a comment that you can make on someone's positive or negative feedback, or you can tell them you're going to be reaching out to them. I personally, when I'm looking up reviews and I see that the business has taken the time to respond and even thank them for the review, I feel like they actually care. And that makes me more prone to want to go there because I feel like they don't just take their customers, their clientele for granted. And that goes for healthcare as well. I think that there are some tips that we could provide to make sure that people are willing to do your surveys. The first one is Keep the survey short and sweet. Don't be asking them 5 minutes worth of questions. Keep it very, very simple and keep it so that it seems relevant to what you're doing and what your goals are. The best thing is to try to capture them right after patients are seen or have visited your clinic, because their experience is very fresh in their brain and you want to capture as much of that as possible. And again, make it as easy to complete on a mobile device, because people like that and it's very efficient for most people who are busy that they can just do it right there. And again, always saying thank you is gonna go a long way. That is a basic politeness. That is something that should be ingrained in us, but unfortunately we do get busy in something like this, but saying thank you can really, really go a long way for not only the person who left that feedback, but also people who will be looking to see those reviews, okay? So I encourage you to look and see what technology is available to you for your existing systems, to see if there is a way to get these automated, to get these created and sent to patients with your existing EMR system. If not, then you need to start doing some research on what third-party softwares will integrate with your EMR if possible. If not, then how you could get it to work simultaneously with your EMR parallel for when patients are seen, to be able to get those things sent out or recorded. And if you have any questions, I would love to try to answer them for you. This space has grown significantly over the last probably 5 to 7 years. So there are a lot of businesses and companies out there that I'm not even familiar with, let alone have worked with, but I will do my best to try to answer if I can. Again, get those patient surveys out there. They're very, very important, and make sure that not only implementing how to get them out, but who's going to be reviewing that feedback and what you're going to do with it. If you found today's video helpful, please smash that thumbs up button. Subscribe to my channel if you haven't already, and please share this with your colleagues that you feel would benefit from this information. I appreciate you watching, and we'll see you next time. Bye-bye.